The large muscle mass of the posterior leg is composed of the gastrocnemius and the soleus muscles. Together, they form what is known as the triceps surae that attaches to the strong calcaneal or Achilles tendon. The superficial gastrocnemius has two heads and crosses two joints, the knee and ankle. The soleus is deep to the gastrocnemius, yet its medial and lateral fibers bulge out from the sides of the leg and extend further distal than the gastroc heads.
So, before we go to the table and palpate, let's just see these muscles in action. I'm going to ask my partner to just stand up on his toes, and as he plantar flexes the ankle, wow, what a great example of the gastroc and soleus. Here we have that lateral head of the gastrocnemius. There's the medial head there. Here we see a bit of the soleus bulging out the sides and coming out underneath as it blends in with that calcaneal tendon here at the calcaneus. And now let's turn them around. Go ahead and face the other direction and stand up on your toes. And notice that the gastroc and soleus are visible from an anterior view as well. Here's that edge of the shaft of the tibia, and all of this tissue right here is the soleus as it bulges out the side. We can even see a bit of the gastroc head here and here coming out the side as well. And so all of that is part of the muscle tissue that we'll be accessing on the table. So let's go do that. So my partner's prone on the table, and we'll begin by isolating the gastrocnemius. I'm going to just set my hand on my partner's foot and ask him to just try to step on the gas a little bit. Great. And as he plantar flexes, there again we can see those gastrocnemius heads right here. And if you ever get lost and you can't figure out exactly how long or short they are, you can pretty much divide the leg in half, and right at that half point will be the bottom of the gastrocnemius heads. And if I want to get my fingers on them, I can just really grasp some of this superficial tissue of the calf. Now notice, I'm not grasping all of this. No, that's the gastroc and the soleus. No, we're just looking for the gastrocnemius here. And I can follow the bellies up to the back of the knee. And if I ask my partner, just try to bring your heel toward your hip. That's right. So as he tries to flex the knee, there we can see the hamstring tendons. And that's where the gastroc heads pass in between those tendons to disappear into the back of the knee where they attach onto the condyles of the femur. Now those are the gastrocnemius heads, and deep to those will be the soleus. And really, if you grasp the tissue of the calf, that deeper, really massive amount of tissue will be the soleus. Yes, the three flexors are deep to the soleus, but they're really quite small. This will be the soleus. And I can follow it distally as it blends into that calcaneal or Achilles tendon to attach there at the calcaneus. Good. Now, a fun little way that you can differentiate the gastroc from the soleus is you can flex the knee and ask your partner to step on the gas. Now, since the gastrocnemius is an ineffectual plantar flexor, in this position, it doesn't really engage. It's nice and flaccid. But deep to it, all of this tissue that is engaging is all the soleus. So it's a fun way to sort of turn off the gastrocnemius. Great, and relax. And finally, if we want to shorten the gastrocnemius, I can flex the knee and plantar flex the ankle. Plantar flexing the ankle also shortens the soleus. And to lengthen the gastrocnemius, I can extend the knee and even just dorsiflex the ankle. And dorsiflexing the ankle will also lengthen the soleus.